Thank you, Al. I was at the ESSM in Bari a few months ago, and I met up with Faisal, and I said, what is this topic all about? What do they expect me to talk about? He said, well, you can talk about anything. If you don't know, they don't know. So this will complement Chris's talk, actually, mainly on satisfaction, so I'm not going to be talking about the actual surgery. How do we do this? The green button should go. Okay. We all know this from our mentor, Steve Wilson, under promise and over deliver. But there is a great mathematician, Ignacio Moncada, that puts that equation. It's much easier to realize that actually the patient's experience is the same. And so the lower the expectation, the higher the satisfaction. So be careful what you offer the patient. You offer them the nice brand new spanking Mini on the left, and they're not happy if they end up with the one on the right. It's all about size. And you heard Chris talk about the cursed patient. I won't go through that. Thank you, Chris. It actually means I don't need to go through all of Landon's slide also. But I think as surgeons, we're guilty of actually operating on these patients. It would be a lot easier if we didn't operate on them, but when they've got their $10,000 of cash waving in your face, it's quite difficult to say no. Here's a patient in my consultation rooms, Mr. Rossi, a good English name, 37-year-old, Peyronie's disease, diabetic, failed PD5s and quite a significant curvature. And you'd all agree this patient probably needs an inflatable penile prosthesis. So let's hope the sound comes with this. There should be some sound coming with this.
Length. I used to be 9 inches, and my length was great before that. And my girlfriend was so happy, and now I get the feeling she's complaining, she's not very happy.
I think we measured you at about 5.5, 6 inches. Half an inch at best, probably. Maybe with some stretching as well, we can get some more, but you're not going to get back to what you were.
Is it possible to have at least the longest implant possible? There are quite long ones, right?
Yeah, well, they're all different sizes, but the most important thing is you put the size of the implant that you measure. If you start putting lengthier implants in, you'll get abnormality, you'll get curvatures, you might get pain.
I did quite some reading, and I've seen that there are some techniques that may be really helpful for my case. Have you ever heard of a sliding technique?
God, sliding technique.
It's an Italian technique?
Yes, I've done a couple. The trouble is it's pretty risky.
But they say you get 3 inches back.
I know.
It's a lot.
I know, but you're diabetic.
But Professor Ralph, I'm absolutely in your hand for this surgery, and please try to give me back my length. I had some video calls with other surgeons. There was one from Brazil, another one from Serbia, and they all told me that you were the person I had to talk with, that you're the best in this field, and you really made a lot for everybody. And I really like your help.
That's very nice of them to say that.
You're the only one for me.
I know. Okay, so that's the typical patient, cursed patient. So patient is shopping around. He's saying that you're the best. How can you refer him to someone else if you're the best? And unrealistic expectations. He was 9 inches. I've lost half my penis. We've all heard that before. So with regards to satisfaction, of course, surgical experience is important. And the implants are improving all the time. But as you can see from the bottom, it's selecting the correct patient and consenting them, informed consent. So I think we've all realized that actually probably the main reason for dissatisfaction is penile length. There are some other aspects, particularly if you've had a complication or if you had to revise, the patient's generally unhappy. If the partner's unhappy, the patient will be unhappy. But from our point of view, when we see the patients, it's mainly all about length. I would advise you to have a counseling clinic for your patients. You're not present at it. You decide this patient needs a penile prosthesis, and then let someone else decide and give them informed consent who is unbiased. And we have a nursing clinic. There's 2 nurses that go through all of this. They take half an hour with the patients. They show them all the implants, and they've got certain patients that they can talk to if they wish. I mean, this sort of thing gives dissatisfaction. I mean, you need to tell the patient that if you're going to have this particular device, you're going to feel it, and you may feel those wings. You don't want to actually have a dissatisfied patient post-op when you've done a fantastic result. So as I said, it's all about length. I'm sure we've had all patients using the vacuum device pre-op. I've had it, and they come into the clinic, they put their penis in the vacuum device, they pump it up, and it always seems to go to sort of 16, 18 centimeters. You'll never get that. So just be slightly careful when they bring the vacuum device in with the mark on it, because that's not realistically what you're going to achieve. Yes, you can do some adjunctive procedures, so ventral phalloplasty and fat pad excision, or with the Peyronie's, as I said, you may get a little bit of extra length with your multi-slit technique, but I think it's important that you do aggressive rehabilitation to prevent the capsule formation, and then perhaps you'll actually have a better length and a happier patient. I don't know what you guys do, but certainly in the clinic, and I agree with this paper, is you just get the stretched penile length. You tell the patient, this is the length your penis is going to be. They can't believe it, of course, that this is the length it's going to be, but it is the length it's going to be. And if they're not happy, you probably shouldn't be doing the operation. I think as surgeons as well, it's important that and this is where the experience of the surgeon, if you have a Maserati penis, as you can see there, then of course you're not going to get that 15-year lifespan of the implant. You're going to get fractured tubings, as you can see there. And likewise, this is another patient of ours where the reservoir tubing was palpable, and clearly with trauma, it's not going to last very long. So the patients, certainly in the UK, have to come back in. Yes, they may get a new implant for free, but they actually have to pay for the hospital admission. We also have a group discussion, a multidisciplinary therapy, and that involves urologists, radiologists, our nurses, and of course the junior staff. And so if you do have some of these patients that are difficult, then it might be worthwhile just discussing this with your colleagues, not accepting the fact that you've been referred a patient, because of course that might be your enemy. And if they're not happy, this is just my experience, this patient was camped outside of my private office, and any of you know Harley Street, it's quite a prestigious street. He was there for 1 year with all these placards, and the hospital said, David, unless you get rid of this patient, we're going to get rid of you, because it was everyone was starting to complain. That's my wife actually in the picture there, and she was trying to put the rope of the tent around this car tow bar so that the tent will be dragged off. But that's 1 year. So you're going to have difficult patients, so make sure that you don't operate on the ones that you know are going to be difficult. Thank you.